Every person in his or her lifetime will probably experience some sort of hair loss. Women typically around menopause with hormonal fluctuations will start to lose some hair on top of the scalp. Men, as early as our teens, will start to recede a frontal hairline. Anywhere from an eighth of an inch to a full inch of our frontal hairline can be lost every 10 years of our lifetime. And on top of that, to make matters worse for a lot of guys, we start losing hair usually on the crown or vertex of our scalp in addition to have a receding hairline. And the reason for that is because of the hormone receptors those hairs on top of the scalp have. Those on the back of the scalp do not have the same type of hormonal sensitivities, so we can safely remove them from the back of the scalp, transplant them into the top of the scalp, and not worry about them falling out later on like our own innate hairs will over time because of hormonal and genetic influences. There are a lot of advantages with hair transplantation. Most significantly would be the fact that it's your own hair. We're taking the individual's hair, removing it from the back of his or her scalp, and transplanting it to the top of their scalp. And in many instances, it's instant gratification, as opposed to taking a pill or applying a topical solution for months or years on end and not achieving the benefit that he or she is trying to obtain. And number two, it's your own hair. You don't have to worry about taking a toupee or a mat and gluing it down to your scalp and utilizing someone else's hair to achieve that. During the transplant procedure, the greatest importance for us is to make sure that our patients are very comfortable. In other words, we want to make sure that there's no pain involved. We'll use a local anesthetic, inject it into the back of the scalp where we will be removing the donor hairs, and then get the patient into a comfortable position, usually laying down on his or her belly. We'll typically use a mild general sedative, not general anesthesia, but a mild sedative to also ensure that complete comfort is obtained. We'll then make an incision or cut from the back of one ear to the back of the other ear, in the shape of a football ellipse, if you will. And typically in that ellipse or strip of donor hair, that'll provide us enough donor grafts, typically where we can cover a fairly large surface on top of the scalp, which is where most of our patients will lie with their hair loss. If someone, for instance, were to have a complete loss of hair on top of their scalp where they're completely bald, then of course we most likely need to have them undergo multiple procedures to cover that entire area. But for the majority of our patients, they want to fill in a little bit to the front, they want to fill in a little bit on the back, and typically that one strip is adequate to provide that coverage. With the open area, we will then suture it together with 2 layers of suturing for maximum strength. We want to keep that scar as small as possible afterwards. And after the suturing is complete then, we'll then take the patient, have them into a much more comfortable sitting position, where then the recipient sites where the graft will be placed, the multiple grafts will be placed, inserted and planted on top of the scalp. That process in itself usually takes about 3 to 5 hours, depending on the number of grafts utilized. My name is Dr. William Coe. I trained in dermatology at the Cleveland Clinic Foundation in the Department of Dermatology. I've been a board-certified dermatologist for the past 11 years in practice at Arizona Dermatology and Cosmetic Surgery Institute with my associate, Dr. Neil Superfond. I'm presently the president of the Phoenix Dermatological Society, and I practice general dermatology as well as dermatological oncological surgery in addition to hair transplantation surgery. We like to provide the entire gamut of dermatological care for all of our patients, and I'm proud to say that it's been a fantastic 11 years in practice, and look forward to many great years ahead with all the wonderful patients that we've seen and have yet to see.